Hello, my name is Luiz Bonino, and today I'm going to present the semantic data model that we created for the World Health Organization's COVID-19 case report form. This work has been done together with the Rajaram Kaliyaperumal, Marc Nieuwland, Jeroen Beliën, Bruna dos Santos Vieira, and Lana Meiqari. The work presented here happened in the context of the Virus Outbreak Data Network, VODAN. VODAN is a Go-Fair implementation network that has as objectives support, create, develop, demonstrate, and deliver solutions to improve data reuse about virus outbreaks. The first project on VODAN was to design and develop the so-called VODAN in a box. The box is a solution to support capturing, storing, and exposing data and metadata related to virus outbreaks. The solution should allow local deployment of the completed toolset so that data and metadata stay wherever their owners, creators, or curators decide. So you don't need to use a service that stores data elsewhere. It's your service or a set of services. In this case, it's a toolbox. All of them can be locally deployed in whatever server you have access to and you can control, so the data and the metadata is completely under your control. In the first version of the VODAN in a box, we have the situation where we want to report COVID-19 cases. That was the first use case that we wanted for VODAN. For this, we used the WHO COVID-19 case report form as the base model. Because we wanted the resulting data to be machine actionable, increasing their fairness, we defined a semantic data model for the WHO CRF. Then we took this semantic model and we embedded that in a tool called the CRF Wizard, which has been adapted from a tool called Data Stewardship Wizard. We adapt that to accept as a web form the content and the template of the WHO CRF. In this way, the tool creates a web form or web forms that are easy for anybody to fill, and these forms are 100% compliant with the WHO CRF template. And then once you fill this, the tool applies the semantic model that we embedded there, and then we can generate properly annotated RDF that's stored in a triple store. So the data that people entered by filling the form is transforming into RDF using our semantic data model. For the metadata part, we defined the semantic metadata schema to describe CRF datasets and publish the metadata in a fed data point. When someone uses the CRF wizard and enters a new case report, the wizard automatically communicates with the fed data point and updates the metadata of that dataset. So a new case being reported will be part of a given dataset, and then when we update, or the system updates that dataset, then the wizard communicates and updates the metadata about the dataset that's in the fed data point. The focus of this presentation, of course, is the CRF semantic model. As I said, it's based on the WHO COVID-19 CRF, the rapid version, and this CRF is a questionnaire composed of 3 modules. One that should be filled at the time of someone's admission at the care facility. It's called the admission form. The other module can be filled multiple times daily or in whatever frequency the care providing facility has resources to, and then these follow-up forms are used to provide information about the updates of the conditions of the patient during the hospitalization time. The third module is called the discharge or death form or module. Should be filled once at the time when the patient is discharged from the care facility. The WHO CRF template is a PDF document that contains a number of questions and answers like this segment shown here. Because of the inherent difficulty that this format, meaning PDF document, poses to machine actionability and to FAIR, we decided to create a semantic model for that. The main goal of our model was to support semantic annotations for the data created based on the WHO CRF. The focus was to model the questionnaire as it is presented by WHO, meaning the questions, answers, sections, and so on, and not to model the biological phenomena. So that's why we call it a semantic data model and not a domain ontology about COVID or virus outbreaks. We published the model with CC BY license. We provided a persistent URL identifier for the model. We published that on GitHub, so it's available on GitHub and on BioPortal. And we have a documentation as shown here in this last link of this slide. As I mentioned, we focus on modeling the questionnaire. We started with the concept of the WHO COVID-19 CRF itself, which in our model is a subclass of the clinical or research assessment questionnaire defined in NCIT. The CRF is about a person and has as its part the admission, follow-up, and discharge death forms. Each one of these modules has a number of sections like demographics, medication, laboratory results, comorbidities, etc. On their turns, each section has a number of questions. In this slide, we have an example of how we model one question about whether the patient is using ACE inhibitors. As you can see, we model the question, which refers to the concept of ACE inhibitor as defined in NCIT. We try to improve interoperability by also providing the mappings, in this case, SCOS exact match, to concepts in other vocabularies like SNOMED-CT, MESH, etc. We included in the model the section of the question, which is part of one of the 3 modules already mentioned. The question itself, so we have a concept for the section, for the question itself, and for what this question is about. When the questions are not just yes or no, many of them are just yes or no, did you take this, yes or no, and so on. But I also directly refer to things. We also provide references to concepts that represent these things. For example, in this question, the user should inform whether the patient is taking any antiviral, so yes or no. If yes, which one of the choices the person is taking. So here we provided references to the concepts of ribavirin, lopinavir, etc. So each one of these options given by the question are mapped to concepts in existing vocabularies that represented these antivirals. Moreover, we try to add, again, as many mappings to similar concepts in other vocabularies as possible. Coming back to Vodan in a box and its tools, here are some screenshots of the CRF wizard, which is used as a data entry. On the left, we have a list of existing case reports that someone filled in. And on the right, we are creating a new case or reporting a new case. So that we have some instructions as given by the WHO CRF document. And then we start the questions. In this screenshot, we can see that part of the medication section of the follow-up module, including the question about the use of ACE inhibitor that we saw how we modeled before. In this screenshot, we show the possibility of submitting a given case report to the Triple Store, which triggers the automatic update of the related metadata, or download the CRF data in RDF. For the metadata part, we can see here our demonstration Vaudin Federa point with the metadata about itself. I mean, the Federa point itself. And here we can see the metadata about the CRF dataset of a fictitious hospital. To demonstrate the possibilities for querying or analyzing data from different Vaudin Federa points, we have an example question. Which care facilities have male patients that were admitted with temperatures over 38 degrees, meaning they were admitted with fever? This is the correspondent Sparkle query that it's here just as a documentation. And this is the result of the query on a number of demonstration Federa points that we deployed containing synthetic data. We created this data artificially so that we can make some tests and demonstrations without having to worry about privacy and security. Of course, many other types of questions could be asked for different purposes, like policy decisions, diagnostics, treatment decisions, etc. As next steps, we would like to extend the model to other types of CRFs that are related to virus outbreaks. We're also working on modeling the biological phenomena, not only the form, but what happens in the body, infections, viruses, cells, things like that. And finally, we are collecting feedback from the users who have already deployed the Vaudin in a box to check where we should improve. Thank you, and if you want to discuss anything about this work, please contact me.